I'm Laura Plantinga, an epidemiologist from Emory University and author of the CJSON article, Association of Serious Fall Injuries Among United States End-Stage Kidney Disease Patients with Access to Transplantation. In this study, my co-authors and I explored serious fall injuries and transplant outcomes among adult patients treated with dialysis in the United States in 2010 to 2013. We found that serious fall injuries among U.S. dialysis patients were common, with 6% having a serious fall injury over 2 years. These injuries were associated with 61% lower likelihood of being waitlisted for a deceased donor kidney. Among dialysis patients already on the wait list, serious fall injuries remain common, with 4% having a serious fall injury over 2 years, and these injuries were associated with 29% lower likelihood of transplant. The information gained from studies like ours could help us to identify patients who may need additional support to maximize their chances of a successful transplant. These results could also help us begin to develop targeted interventions to prevent falls and associated injuries in all dialysis patients.
My name is Ray Lynch, and I'm a transplant surgeon at Emory. As a transplant surgeon, I believe reduced rates of kidney transplantation among patients who experience serious fall injuries provide a novel insight into the frail state and precarious clinical situation of these patients. The wait time for kidney transplantation can be long, and dialysis patients' conditions can deteriorate substantially over this time. Because transplant centers are not the regular providers of pre-transplant care, important clinical information such as the occurrence of a serious fall injury may not be communicated to them. Patients often arrive for transplant surgery with previously unknown conditions that could compromise transplant outcomes. Knowing the serious fall history and injury history of dialysis patients, particularly those on the wait list, can help us make better decisions and improve transplant outcomes for all patients.
I'm Barrett Bowling, a geriatrician at the Durham VA in Duke. As a geriatrician, my perspective is geared towards how we as clinicians can support patients in order to maximize their health and physical functioning throughout the transplant process. Identification of geriatric syndromes, such as a fall, is not a routine part of care for patients with ESRD. However, these findings suggest that recognizing serious fall injuries may provide useful prognostic information. A geriatric approach to care for these patients may include using information on serious fall injuries to support clinical decision-making and implementing multifactorial fall prevention strategies in clinical practice to reduce fall-related injuries among dialysis patients and ultimately improve transplant outcomes.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.